Assalamualaikum and hi everyone. My name is Azif Ami bin Didi Aini Rolalia PNT. My other group members, we introduce themselves when they present about their part soon. So, in this video, I'm going to tell you about the osteogenesis imperfecta, which we can acronym that words as OI disease. Have you ever heard what is the OI disease? So, let me tell you about the OI disease. OI is a group of genetic disorder marked by extremely fragile bones that break or fracture easily. It is also known as a brittle bone disease. The severe can cause triple symptoms like hearing loss, spinal cord problems, and heart disease, heart failure. So, move to the type of OI disease. There are 8 types of OI disease, which is the type 1 being the least severe and at the type 8 being the most severe. I want to touch about the first 4 types because these are the most common. So let's start with the types 1. Type 1 is the mildest and the most common types. About 50% of all affected children have these types. There are few fractures and deformities. Next, type 2, more severe types. A baby has very short arms and legs, a small chest and soft skull. Next, type 3. Type 3, most severe in babies who don't die as newborn. At first, baby may have slightly shorter arms and legs than normal, and arm, leg, and rib fractures. Last but not least, type 4. The symptoms are between mild and severe. Baby may diagnose at birth, but she or he may not have any fracture until crawling and walking. That's all from my part. Let's move to another part.
Let's further elaborate on some symptoms of osteogenesis imperfecta. So the first one is the bone fracture. Individuals with the osteogenesis imperfecta are prone to the frequent bone fracture, often with minimal impact or stress on the bone. This fracture can occur in everyday activity. The second one is the short stature. Osteogenesis imperfecta can lead to short stature due to bone fragility and growth-related issue impacting overall height. So the third one is the joint hypermobility. So the loose joint and hypermobility are common and increase the risk of the dislocation and affecting mobility. So the number 4 is a hearing problem. So hearing loss can occur due to the abnormalities in the bone of the inner ear. Conductive hearing loss is more common in osteogenesis imperfecta. And the next is the muscle weakness. So the weakness in the muscle can be associated with the osteogenesis imperfecta, impacting overall strength and physical capability. And then the last one is the early onset of osteoarthritis due to the repetitive fracture and joint issue. Then osteoarthritis may develop earlier than usual. So it is important to recognize the osteogenesis imperfecta is spectrum disorder. Individual may experience a range of symptoms with various severity. And then the diagnosis and management of OI typically involve a team of healthcare professional and including genetician, orthopedic specialists, and other specialists as needed. Yearly intervention and ongoing care are crucial for optimizing the well-being of the individual of OI. So that's all from me.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Zafran Hadi bin Skifli, and I will talk about generic cause of osteogenesis imperfecta. The most common gene associated with the osteogenesis imperfecta are COL1A1 and COL1A2, which encode the alpha chain of type 1 collagen. Mutation in this gene can result in the formation of abnormal collagen or reduced production of collagen, that leading to weakened bone. The inherited pattern in is typically autosomal dominant, meaning that the mutation in one copy of the gene inherited from other parent is sufficient to cause the disorder. So next, I will talk about mechanism contributing to autosomal dominant osteogenesis imperfecta bone dyslexia from mutation type 1 collagen gene to bone defect. Firstly, mutation in either COL1A1 or COL1A2 are translated into collagen chain with abnormal structure, which delay folding of the heterotrimer and result in excess post-translational modification of the collagen helical region. So mutant from collagen chain are enabled to incorporate into heterotrimer and heterotranslocate into the cytosol and degrade by the ARAT pathway. ARAT pathway is endoplasmic reticulum associated peroxisomal degradation. Okay, secondly is uh, fully misfold heterotrimer with structural defect generate supramolecular aggregate that element by artifact. So next is mutant molecule with triple helical mutation are degraded through an unidentified pathway. Finally, abnormal from collagen can be secreted, processed, and incorporated in the extracellular matrix. The secreted mutant collagen are affect fibril structure and interaction of non-collagenous protein with matrix, as well as matrix mineralization and established development and cell matrix crosstalk. The overall result is the bone will deformity and fragile. Although the relative importance of the various contribution is under investigate, still under investigation.
Assalamualaikum warahmatullahi wabarakatuh. Medium, Doctor. I am Muhammad Ahmad Zakwai from group Osteogenesis Imperfecta. Want to present about diagnosis and how this is the disease treated. Okay. Firstly, diagnosis. For diagnosis, firstly we usually if we want to diagnose the osteogenesis imperfecta, we go throughout the family medical history. It is because it's easier to detect if the patient have osteogenesis imperfecta because it's a genetic disease. By taking the family history, we can ensure that this person may get disease osteogenesis imperfecta. Other than that, we will taking X-rays. Why we are taking X-rays? Because when we are taking X-rays, we can look further into the bone density and bone structure. We can detect if there are any fracture or the density of the bone become not compact and easily fracture. So we can diagnosis osteogenesis imperfecta easily. Next, by taking bloods. Why we are taking bloods? Because bloods contain valuable information such as DNA. When we want to diagnosis a genetic disease, we need to assess the DNA to search for abnormality in the gene, so that we can conclude the disease of patient is whether it's a genetic disease or not. And lastly is by taking tissue samples. Why we are taking tissue samples? Because we osteogenesis imperfecta is characterized by the production of collagen, abnormalities in production of collagen, of structure of collagen. So by taking skin tissue sample, we can see the collagen extracted from the tissue. Is it normal or abnormal? So by doing 4 of the diagnosis, we can determine uh, a person is undergoes in osteogenesis imperfecta or not. And next is how is the disease treated? Okay, so firstly, this is a genetic disease. So surely there are not known specific cure for this disease. So we can only manage the symptom. So how do we manage the symptom? Firstly, by physical therapy. Physical therapy with by physical therapy we can use to strengthen the muscle and assess the joint and flexibility of joint and can prevent the fracture to happen. We also can do a supportive therapy such as taking care of mental patient by talking to them, not doing hard and vigorous activity. So Fauzi will continue the rest.
Next, another treatment is the tap medicine. Tap medicine is to reduce the any pain, and the last one is surgery. Surgery, which may include inserting a metal rod in the long bone to improve the strengthened bone. So that's all for us. Thank you.